Hello and welcome to Spine Academy. My name is Terry Chasteen. I'm a registered nurse at St. Joseph Hospital. I started here as a brand new graduate nurse in 1997. Took care of spinal patients on my first day here, and I'm still here at St. Joseph Hospital taking care of spinal patients now. We developed Spine Academy for you to help take the mystery out of your surgery, to help you set realistic expectations and understand a little bit about what's going to happen before, during, and after your surgical process. And we know that knowledge is power, and this is designed to help you have the best outcome you can possibly have. So there are a lot of things you can do at home before your day of surgery ever comes about, and we are here to help you plan for that. What are some of those things? Some of those things can be weight loss, and you may not have time before your surgery to have any significant amount of weight loss, but starting to live a healthy lifestyle now will only help you heal in the future. Also cardiovascular fitness. While we understand that with back issues, it is hard to exercise and get a lot of that done, still moving around and doing a few little exercises may help prepare your body for your upcoming surgery. Certainly smoking cessation is something that you can do for yourself. It is never too early to quit smoking. We know that nicotine is a vasoconstrictor, and it makes it very hard on the body, especially when we're dealing with bone in the spine, to heal properly. And of course, it's also much better for your lungs if you stop smoking. Some things you can do at home with nutrition prior to surgery is increase the protein in your diet. Our bodies need increased protein to heal properly, and starting that now can prepare your body for the future. Examples of high protein foods are lean beef, chicken, eggs, fish. If you are a vegetarian or you don't like those sorts of things, beans, nuts, seeds, peanut butter even has a lot of protein in it, as well as milk, yogurt, and different types of cheeses. Also, high fiber, starting that now, will help you in the future as you prepare to go through this surgery. You are not going to be moving around as you normally do. You'll be taking pain medication. So constipation is a huge concern and is very uncomfortable. So starting taking in more fiber now will help you prevent constipation after your surgery. Examples of these types of foods are apples, bananas, and strawberries. You can also have whole wheats, grains, breads, pastas, and oatmeal. And also vegetables have a lot of fiber, as in corn, broccoli, peas, and beans. Another thing you can do is stay hydrated. Starting that before surgery is also something that could be very helpful for you. And we will continue to encourage hydration as you go out throughout this process. As I just mentioned, constipation is a serious issue that a lot of patients complain about post-operatively. As a matter of fact, we do hear that is one of the number one complaints patients have when they go back to see their surgeon. So why does that happen? Again, you're not moving around as much as you normally would. You are taking pain medication, which does slow your GI tract down, and you've been under anesthesia for your surgery. It can take 4 to 7 days to get back to a normal bowel regime, but we like to help you prepare and prevent constipation to begin with. In addition to staying hydrated, we will also start you on some stool softeners of some sort while you're here at the hospital to aid in that. If you don't go while you're here at St. Joseph Hospital with us, don't worry, but it is something that we want you to monitor after you go home. So some other things you can do for yourself before your surgery ever happens is take a look around your house. Home safety is very important. There are a few tasks I'd like you to take care of before you come here for your surgery. Look around your house. Look for throw rugs, electrical cords, things like that might get in your way as you're moving about your house once you get home. If you have pets, I want you to maybe think about when you get home from the hospital, have somebody secure your pets maybe in the bedroom or in the backyard or bathroom while you get inside. Our fur babies miss us while we're gone. They like to greet you right away, but we certainly don't want them to knock you down as you're getting in the house when you return home. Another thing we like to encourage is work simplification. If there are items you use frequently that are high up in a cupboard or low down in a cupboard, think about putting them out on the kitchen counter or the bathroom counter so they're ready for you to use when you get home. Your surgeons like you to get back to your activities of daily living as quickly as possible after your surgery, but we don't want you stretching way up high or getting way down low because you might fall and injure yourself. And we will teach you while you're here at the hospital what restrictions you have. Bending, lifting, and twisting are the three big ones. We call it the BLT. And we will talk about that more later on in this video. Another thing I really encourage people to do before you come to the hospital is pay attention to your bed. See where the top of your mattress hits your body. The really great thing about the hospital is that we have hospital beds that can get higher or lower, and we can mimic the height of your bed at home. So when nursing and therapy is working with you, we can raise or lower that bed so you can practice getting in and out, so you'll be ready to sleep in your own bed when you get home. I also like to point out at this time that safety is one of the biggest things that we worry about with our patients. When you are here at the hospital with us, we as nurses, assistants, therapists are all trained to help get you up and down. And even though you might feel like you're ready to do that yourself, please don't attempt to. Accidents are called accidents for a reason. So please stop, call out, and let us help you get up and down, whether it be to the bathroom, chair, back to bed. We want you to be safe while you're here with us. So just as a wrap up, preparing before your surgery. Question, what can I do now to assist myself in recovery at the time of discharge? Good food choices starting now, staying hydrated, exercising if possible. Any strengthening you can do before surgery is only going to help you afterwards. Increasing fiber intake is good to help prevent constipation postoperatively. Stopping smoking now, anytime is a good time to stop. And also readying your home for discharge.